It's a Thursday edition of the Bold Republic Radio Show. My name is Glenn Woods. Thanks for joining me. And it's sort of an unusual thing for me, but I have someone in the studio this time, a guest from Wyoming Liberty Group. So this means now I actually have to do the name for real in person here. Okay, Charlie Katebi. No,
so close.
So
close.
Okay,
Yeah.
I was telling them it was it's a dyslexic nightmare to get that name right. So how do you pronounce your name?
Katebi. And
Katebi.
That's a very sympathetic excuse.
Very sympathetic. Yeah, it is. I'm going for the sympathy ploy here on this one. Sure, why not? So you're with Wyoming Liberty Group.
Yeah.
How long have you been with them?
I've been with them since about this February. Yeah.
This February.
Yeah, a few months.
And what's your main role there?
My main role is to write and research about basically what's happening in healthcare in Wyoming and around the country, and what they're doing in Washington, how that affects our healthcare here in Wyoming. So.
Okay, so now this is the important part, because young man compared to me, I'm sorry, you're a kid, and I look at you and I think, why in the world would somebody of your age get into economics and studying healthcare and then move from Massachusetts to the state of Wyoming to do that?
Well, to be honest, most of the healthcare decisions that are being made by people closer to your age, and in Washington.
So it's all our fault. Okay,
yeah. Well, I mean, we aren't really present in the debate. Us young millennials. Yeah. So we are kind of stuck with the bill in a whole bunch of ways.
Yeah.
Whether it's Obamacare or Medicare or Medicaid.
No, you're absolutely right about that. You're stuck with the bill, and your kids and your grandkids are going to be stuck with the bill for this.
Absolutely.
So it's going to go generations out. So how did you get to Wyoming to do all this?
I flew, actually. Well, I was doing some work. with the Reason Foundation in pension reform, and we actually hosted an event with the Wyoming Liberty Group in Cheyenne on pension reform and the benefits. And they needed what I heard a couple months later, that the Wyoming Liberty Group was looking for somebody to come on and basically be able to communicate a very complex topic like healthcare to legislators and the public, and make them just really understand what's going on. And I thought that this was a perfect way that I could help.
Okay, so since you've been here, you've learned what about it, and you're also going to be speaking to Casper tonight about it.
Yes,
so
I will be.
Let's talk about what you've learned and what you're going to be speaking about.
Well, like I said, young people are kind of on the receiving end. We aren't making the decisions, but we're paying the costs.
Right.
And in terms,
well, now wait a minute, paying the costs, but so many young people are not signing up for this.
Yes.
So not really. You're not really paying the costs. You're making the smart move, I think, of getting out of paying the cost.
Of paying the penalties.
Yeah, there you go. Yeah.
That's true.
Yeah.
Well, right for now, yes, the penalties are much less than what it would cost to pay the premiums of the insurance on the exchanges, pay all the deductibles and the co-payments. But in the end, we might not even have to pay that, because if King Burwell decision comes out and he says this are invalidated, then we would be considered ineligible for having to pay the individual mandate penalties.
Right.
Because if the cost of insurance rises above 8% of your income, then you are exempt from the mandate. Because young people make up much less than people that make those decisions.
Right.
We would be really exempt. So
okay. Now, my theory was the reason that in the law people can stay with their parents on their insurance for so much longer is because obviously someone who's of college age can't afford to pay for the penalty or the insurance either way. So might as well just stay on your parents' plan. That way they could pay for it. Am I wrong about that?
Yeah, that was kind of a very juicy bone the Obama administration kind of threw to young people and college graduates. But everyone graduates eventually. And this job market has been particularly terrible. And just naturally, when we go into the job market, we don't have that much bargaining power. We have to start at entry-level jobs, and these jobs are becoming much harder to get these days with rules and regulations. So we are still very much disadvantaged in relation to this law.
Okay, so you graduate, you can't afford Because either you can't find a job or the job, of course, is a starter job, so you can't afford to.
Sure.
So do you still have to pay the penalty, or did Obamacare give you an out on that? Because obviously you can't afford either one.
If the cost of insurance, which has been inflated and bloated because of the Affordable Care Act, is above 8% of your income, then you would be exempt from it. However, that does take into account the subsidies that would come in.
Right.
So if they calculate and say, oh, if you did go onto the exchange and you were eligible for subsidies and you got subsidies and you didn't get it and you didn't get the insurance, then you pay the penalty. So we're still very much subject to it in the current state.
Okay.
If they decide to actually interpret the law as it was written, then a bunch of young people might be exempt from this whole thing.
All right. Now, you told me last night part of what you'll be talking about is Medicaid expansion?
Medicaid expansion.
Medicaid expansion. Okay.
Yes.
In the state of Wyoming, Governor Matt Mead decided that he was not going to he wanted to expand, but the state legislature said that. So where are we with all of that in the state of Wyoming? And some of the surrounding states, did expand. Some did not.
Yes.
So, okay, where are we at now? Because to me, I think we're in trouble.
Well, yes. So Medicaid expansion, the way it works under the Affordable Care Act is they're going to expand the eligibility, the floor eligibility for everyone on the program to 133% of the federal poverty line. 30 states have signed up for it. 20 states, including Wyoming, has refused. And the reason that proponents of it have put up is that it's basically free money. So until 2016, which is next year, the cost of the Medicaid expansion will be free for these states.
Well, and people will tell you, and you'll know after you get to know me a little bit better, never use free, especially when you're talking about the federal government around me, because it's not free. Somebody's paying for it. Future generations are paying for it. Your kids are paying for it. Your grandkids are paying for it. So, obviously, there's nothing free here. Somebody ends up paying for it. Right?
Of course. But even in that regard, it's pretty murky whether or not they'll actually keep that promise, because the federal government has a very long history of going back on funding promises. Right. So they promised with Medicaid expansion to cover 100% till 2016. And then a few years later, it'll go back down to 90%. So states will only be responsible for paying 10% of the cost. However, there are a ton of programs. There's one called the Individuals with Disabilities Education Act, which promised starting 40 years ago that they would cover 40% of the cost of disabilities education programs in the states. And the federal government, for not a single year, has actually fully funded that program. And states have been on the hook for an extra $250 billion.
Okay.
Yes.
Add to that, states have made projections, and the federal government has helped them make projections on how many people are going to be on these programs.
Yes.
And then all of a sudden, a wave of people come into the state, and so it far exceeds the number of people that they projected, which tends to crash the system.
Exactly. So it's not just the relative costs of 90% versus 10%. There's also, even assuming that the federal government's going to keep that promise, there's the absolute cost. And you're absolutely right. There are about 20 states that have 30 states that have chosen expansion. And there are a number of states that have come out and said what the enrollment numbers were. And we can measure the actual enrollment numbers against the projected ones. And 16 states that actually put out those numbers, their average enrollment was 96%. So nearly a double what they actually predicted what would happen. In Colorado, our neighbor to the south, their enrollment was 207%. It was triple what they projected.
Okay, yes. So the big question has to be, if the enrollment was 207%, triple what they predicted was going to be.
Yes.
I love the answer to this. Where did those people come from?
A lot of it, first of all, a lot of them come from states that didn't expand. A lot of it is also the fact that they just did not have that much expertise in thinking, in knowing, or planning, just having a blanket expansion. Because typically before, the way state eligibility worked is they granted certain eligibility for pregnant mothers, for the elderly, for the blind, and they were able to tailor these minor changes. This was just a blanket expansion of eligibility. So they really didn't have much experience knowing how to really forecast this.
Okay, and what about people coming in from other states? Because, for example, you met last night, Dr. John Mansell. You hung out with him yesterday. He just recently moved from Illinois to here.
Yes.
Okay, so moving from Illinois to here, you can imagine how that state was flooded. And it was flooded from people outside of the state that showed up in Illinois to take advantage of the system.
Yeah, they were actually the second highest enrollment above their projection. So they were at 172%. Wow. So yeah, so we can actually look at this and think, hey, if Wyoming actually went along with expansion this year or last year, because this is about the second time that they tried, supporters tried to pass Medicaid expansion, we could look at just going by what the average was for these states, what would our enrollment be? And we predicted 17,000. Those were the conventional numbers. But if we went up to 96% above projections, we would have ended up with over 33,000 more people on Medicaid.
And a lot of those people just on medical vacations, basically.
Yeah, that's another big thing.
Okay. Yeah. So if you have a projection that shows, okay, this number, let's say 100,000 people are going to show up.
Sure.
And so you go up to 200,000 people, it doubles. Does the federal government come along and cover that?
Absolutely. This is about eligibility. It's not about the numbers.
Okay. Now, how long can the federal government cover that? Because I look at the national debt clock every single day on this radio show, and I don't think that they can cover that for very long. I don't believe the money's there.
Yeah, they call it free money, but yeah, you're absolutely right. It comes from where, and like with everything in this world, money is scarce. There is a fixed amount at any one time. So yeah, and so like I said before, this wouldn't be the first time that the federal government decided to renege on its promises. And this isn't just a hypothetical when it comes to Medicaid. In 2013, when the Obama administration was going around states and telling them that this is good, it's free money, why not expand it to your vulnerable populations? Well, in 2013, he released a budget that would actually completely revamp the funding regime that we have for Medicaid. Yeah. So right now, there's 100% and then 90% of the coverage of expansion. That's what the Obama administration is going to pay for expansion. But there's another one for the traditional Medicaid expansion. And for Wyoming, they cover half the cost, 50%. What the Obama administration proposed was scrapping those different rates and just having one blended rate, if you will.
Right.
And it would be the average between those. It would be 70%. So the Heritage Foundation actually went into a state-by-state analysis as to see how much would that contribute to raising the cost of Medicaid for the states purely. And that would have raised the cost of Medicaid expansion on the states by $78 billion over the next 10 years. And for Wyoming, that would have equaled about $76 million more because they would have had to contribute much more to the Medicaid program. So it's really a bait and switch in which they promise this free money and they say it's a contract or a promise, but one of the parties in this promise can just change the conditions whenever they want through Congress or laws.
I've got to ask you, the governor of South Dakota, North Dakota, Montana, did they not read the fine print when it came to this? Because, I mean, you and I are obviously seeing why they shouldn't expand, but they all want to. What's the problem?
Well, the problem is that the way the Medicaid program has always been worked is that it encourages a lot of promises, and states are relatively free to renege on them if they feel like it's cutting into their budget too much. Because the way it works is there is a certain amount of mandatory benefits and mandatory eligibility, and also mandatory optional eligibility and optional benefits. And states are free to, and the federal government will fund at least $1 per dollar of those promises. And that depends on, so for some states, for every dollar you contribute to the program, the federal government will contribute $2 to it. For Wyoming, that's one of the lesser ones. They'll only contribute $1 for every dollar we do. So it encourages, so what that arrangement does is encourages states to promise a lot in terms of expanding enrollment and expanding the benefits that it'll cover, but really doesn't on paper. But from what we've seen, a lot of times people actually don't have greater access to care. So it encourages a lot of benefit promises.
Well, promises, but then, and I thought South Dakota had the right idea here. Governor of South Dakota said, well, this is what the federal government is promising. But if they don't keep up with their promise, we get to dump the whole thing pretty much just overnight.
Yeah, a lot of states have thought about, considered that. We absolutely did as well, where we said, well, we would take the Medicaid expansion money until the end of 2016, when the reimbursement rate for the state and the federal government starts to go down to 90%. However, that's kind of ridiculous, because as soon as you do, that's become a program that people are entitled to. They feel it's their property and it's theirs, and they will go to the legislature and lobby for it. So either they're being completely naive, or they realize that there's no chance in hell that program will ever go away, because states have been able to, although states have cut the reimbursement rate for doctors, that's the primary way in which they control costs. There have actually been very few times in which they have statutorily restricted what benefits are available, who is eligible for them, which is really essential to if the program's actually going to help people.
Well, and you mentioned doctors. We don't have a whole lot of time to go into this, but basically the reimbursement rate for doctors makes doctors look at the program and think that they just don't want to be a part of this in most cases, because they can't cover their costs. Yeah,
there's actually a really direct relationship between how much they reimburse doctors and how many doctors are actually willing to cover for them. So in Wyoming, we actually reimburse Medicaid pretty well, but there's a strong correlation between the less you pay doctors, the lower the share of doctors in your state that are willing to actually take Medicaid. And another interesting statistic is that the states that have some of the lowest reimbursement rates have some of the highest eligibility standards as well. So even as they're promising we're going to cover children at 300% of the poverty line, and young adults at 150% of the poverty line, they are reimbursing doctors for 30% of the cost of care, or 40% of what insurance would pay. So even though they're promising it, they're not actually delivering the care.
Well, and finally and quickly here, so the next problem tends to be that when we're told the emergency rooms would not be full, doesn't this help drive people to the emergency rooms?
Yeah. So there was a study in Oregon done by a couple Harvard economists in which where it was a really interesting experiment, where there was a pilot program where they analyzed how many people, where there was a lottery for Medicaid expansion, and they said they looked at who was going to be going into the emergency room, and they found that the people that were not accepted into Medicaid actually used the emergency room 40% less than people that actually went onto Medicaid.
Very interesting. Thanks for coming in. I appreciate it.